Colm, can we start with the changes in the vaccination programme that are going to be necessary because of this recommendation from the National Immunisation Advisory Committee? The people aged 70 and over should not receive the AstraZeneca vaccine. Like, you had a plan, no fault of yours, but you now have to redraft the plan. What's the new plan going to look like?
Good morning. Well, this highlights what turbulent times we're in, and that we're launching a vaccination programme in the middle of a pandemic, and we're launching it as we're building information all the time. And the information comes from two sources, basically, Shane. One is from the trials, the phase 3 trials themselves, which give us a lot of reassuring information about the safety of these vaccines and how effective they are. And the second comes from on-the-field experience. And at this point in time, the AstraZeneca vaccine, very effective vaccine, very safe based on the trial experience, and also evolving evidence showing that it reduces not just serious illness over a protracted period of time, but that it reduces transmission. And that evolving evidence is coming through now. But at this point in time, we just don't have enough evidence based on the type of people and the profile of people recruited to say that it has the same efficacy in older people.
No, look, and we get that. You're playing it cautious, and I think most people would welcome that. And look, most people would say, fair enough, you now have to change the plan. No one's blaming you for that. But I suppose, what is the new plan? How are you going to vaccinate those, firstly, over 85? Because I think the plan is still to go ahead middle of February, middle of this month, you're going to be vaccinating them. How, though? Because the other vaccines, the Pfizer, BioNTech and the Moderna, are trickier because they need cold storage.
Well, it is trickier, of course. I just came directly here from following a call with GP colleagues, which we have every week from the beginning of this pandemic, and we're discussing how we can fit this peg into a round hole, and it is more tricky. Now, that said, we're absolutely intent in using and harnessing the same GP network. Why? Because GPs are best placed to identify older people. They're the most trusted healthcare professionals for older people, and they're the people best placed to advocate for this vaccine and to reach into every household and to every highway and byway in Ireland to make sure that the maximum number of older people know about the vaccine and get access to that vaccine. So we want to use that same network of GPs to vaccinate and to advocate.
But you can't have a giant freezer, I presume, in every small GP practice.
No, we can't. But there is overlap between what is undoubtedly would have been the easier rollout of AstraZeneca vaccines in primary care and the provision of the Pfizer or Moderna vaccines, the so-called mRNA vaccines. And there is overlap, and that involves looking at those larger, more congregated GP settings. It might it might also involve looking at what are called GP hubs, where we bring GP practices and GPs together for the express purpose of delivering vaccination. And of course, there's the trickier endpoint of people living in more remote areas.
Yeah, because that's a difficult one. Because people would be neighbours would be happy to give a lift, but then they're thinking, oh, can I give my neighbour, my 90-year-old neighbour, a lift? Is there a danger about that? How does that person get the vaccine? I suppose
that's exactly what we're working out, and we make it clear we want to roll this vaccine out to everybody from Inishowen down to Wexford. We want to make sure everybody gets access to it, and it's trickier. And I just want to assure people, if we were making easy decisions based on what's easy for us, we wouldn't have been picking this vaccine.
No, fair enough.
Basing a decision.
But how do you get around that? I mean, what do you think? What do you consider in terms of transport? Would you have sort of dedicated transport?
We're looking at, as I say, for many of the people involved, especially in more densely populated areas, the cities, the towns of Ireland, we expect to be able to bring people together, if not in GP surgeries, but in some hubs where we bring GPs and practices together to give the vaccine. For those people in more remote areas, we're trying to figure out again how we bring the relatively small volume of people in smaller GP practices together into some common area to give the vaccine. And of course, putting safety a priority to ensure that they're kept safe on the way there and on the way back. But we'll get there.
Does it slow things down dramatically? Are you still, I think that the plan was all over 70s by May. Is that still a realistic goal?
We'll get there. One of the reasons for this decision was made was based fundamentally on two reasons. One was the proven efficacy of the vaccines, the mRNA vaccines in older people at this stage of our knowledge. And secondly, it's a shorter time interval to get to those 2 doses so that you have the immunity confirmed by the whole programme of the virus. And it's a shorter programme with the mRNA than it would have been with the AstraZeneca vaccine.
Okay, the AstraZeneca vaccines that are arriving next week, who's going to get them, Colm?
again, just to reassure, if I could just take the opportunity, they're safe, they're effective, there's evolving evidence that they work very well. So we'll be using those. We're trying to go through those priority groups that the government published, was put together by NIAC, the government published at the beginning of December. And we want to complete priority healthcare workers, huge number of them, Shane, right across the country. So we've got through certainly 85,000 at this stage, but we have another, perhaps that same number again to get to. And we want to provide that AstraZeneca vaccine, to divert that vaccine to those younger cohort of people in that priority group, what we call priority 2 healthcare workers, complete that out, and then go down to category 4, 5 and 6. And category 4, of course, are healthcare workers who don't have direct patient contact. But we'll be getting to those in adhering as closely as possible to the sequence that's laid out in that priority document.
Okay,